thank you. I know it's tough on the guys standing back there, but we know your love for this issue and hanging in there. Janine's great being next to AARP. We know how to find bin Laden. Wait till he's 50. AARP will find him. But, the one battle that this initiative is going to have to face is going to be whether purity of purpose can win out over politics. I got a phone call on the way over here from a Republican, one of my fellow Republicans, that questioned me on the validity of this being a Republican issue, and really saying it was a miracle, it would be a miracle, if this got passed, people of California. Well, I don't think it's a coincidence, maybe it's just God's way of staying anonymous, that we're in a season of miracles. And Fabian Nunes and myself agreeing on something, let the miracles begin. But, this is, I'd like to know where it says in the Republican commandments, thou shalt not have universal health care. To be called a bad Republican because I'm supporting this gets on the fighting side of me. It really does. I believe in a strong national defense. I believe that onerous taxation on individuals, families, and businesses is bad. I believe the sanctity of life starts in the womb, and I believe in universal health care. If that makes me a bad Republican, so be it. But I think there's Republicans all over this state that can't wait to vote for this. Because we know this isn't a left-wing issue. It's not right-wing. It's just the right thing. And the governor, it's long, so I'm not going to go into the story. He had asked me to speak on a personal note, and I'll sum up real quick. I do have a personal vested bias in this. I lost my daddy when I was 19 because of a lack of health care. He was a migrant farm laborer, worked in the San Joaquin Valley. We moved 6 times in 5 years, third grade education, but the smartest man I've ever known in my life. Got a call when, as I said, when I was 19, rushed back from University of Pacific to find him in the University Medical Center, waiting in bleachers with 30 Mexican workers and my dad. Walked up to him, I said, Daddy, why aren't you getting in there? He says, well, they're trying to see who can get in, who can't. About that time, a family walked out, tears streaming down a Mexican man's face. He was emaciated, probably in the latter stages of cancer, what I suppose to be the case. And it's time for my dad to walk in. Well, he walked in. 5 minutes later, he comes out and says, Doc, call me Doc, let's go, ironically. He says, let's go home. I said, why? He says, they're not going to let me in, let's go. I said, no, wait a minute. I went in. I had a better shot because I could speak English. And I told this gentleman, look, I know my dad. He's one of the hands that feed the world. He's been laboring in these fields to miss a day of work. This man would rather die. That's why he's here. He looked at me, and I'll never forget the look on his face because he wasn't a mean man. He had to make decisions based on this system that he was forced to work under. He says, let me tell you, that means a lot. Bring him back in. Well, he got in. I breathed a sigh of relief, walked out, and I was walking out. I walked past those bleachers. I looked up, and there was another Mexican man with the straw hat in his lap. I'll never forget it. He looked down at me. I was waiting for the door to open. I looked up, and he looked down, and he smiled as if to say, good job, you got yours in. Well, I went back to college. 2 days later, I got a call that my daddy's back in the hospital again. What had happened, he had been operated on by a doctor who was on leave from the National Guard. You see, doctors get their training on poor people, those without insurance. They don't operate on the Bill Gates of the world. No dispersion against Bill Gates, but that's just a fact. Well, they let him go without checking him out because he didn't have insurance. Rushed him out of there. He had peritonitis on a gallbladder operation. Had set in. 5 weeks later, my 220-pound daddy died at 90 pounds. I'd like to say that I took up the torch then, but I didn't. I went on and finished college, got drafted by the Green Bay Packers, went on and lived the world of sunglasses and autographs. Didn't think much about that Mexican man that looked down at me when I left. And when I took this office, I sure did. And I thought about him a lot because I know what happened to my dad. My dad got in the system and he died, but he had a shot at the system. He got in. Where did that man die? Did he drop dead in the field? Did his granddaughter come in and find him in bed, passed away? What happened to the 40 other people that were up there? So that's one of the reasons I'm here, because it's not a political issue. It's not an economic issue, it's a moral issue. And Governor, I want to thank you, and Fabian, I want to thank you, and the whole assembly here, because, and especially under these conditions, Governor, we spoke about it the other day, we have some tough budget times ahead of us. But it's un-American to let our condition of the moment dictate our vision. If that's the case, we would have never made it out of the Great Depression. But we did. So I want to thank you for your courage to move forward during these difficult times and say universal health care is for everyone. So on behalf of my daddy, on behalf of that Mexican man that I can't get out of my head, and I hope I go to the grave with them, we can do something about it for them now and for the countless others who have fallen because of this system, but more importantly for those that are going to be saved by it, especially our children.